Has your health been covered up? Today, it's Revealing Wholeness with Dr. Troy Munson, presented to you by Infinity Whole Health.
Hello and welcome. I'm Dr. Troy Munson at Revealing Wholeness, and today I have a guest on the show that I'm excited about. For years, I've had clients ask me about mammography and alternative, or not necessarily alternatives, but what can they do instead of irradiating their body? How can we do some early detection stuff? And today I have somebody here that can't wait to introduce, is Shanna, and she is going to talk about thermography, and not just breast thermography, but the entire body. Tell us a little bit about what you brought here today.
Thanks for having me on, Dr. Munson. Yeah. I have a sample full body report for you to look at today with me.
Okay.
And every time I have a patient who gets a scan, I encourage them first to take it to their doctor so they can go over the results with their physician. And then I do a follow-up call afterwards to make sure they didn't miss anything really important in the report.
Okay.
I basically want to make sure all of my patients get the most benefits they can out of their thermography results, so I go over them as well, and I give them some tips, or I connect them to wellness professionals like yourself to help them improve their follow-up scan when they come back to me.
Okay, so let's say we have somebody out there right now that's thinking, hey, I've heard of thermography, or maybe I haven't even heard at all about thermography. Can you give us a little background on how they would know if this is right for them?
Certainly. Thermography is infrared imaging, so I have an infrared camera, and for the full body report, like the one we have in front of us, I take about 30 images of the entire body. Then I send those images to our team of interpreting doctors, and they let us know if that patient has any abnormal hot or cold spots throughout the entire body. And those heat signatures, they can be an indication for us that something's out of balance. And if the patient has the opportunity and the time to balance out their body, they can head towards optimal wellness and potentially avoid something in the future that no one wants to deal with, like cancer, diabetes, a stroke. So it's valuable information and a wonderful visual to what is going on in your body now and what areas you may need to address.
So you're saying it's not just about breast health, but you're saying you can image any part of the body and tell whether it's healthy or not.
Thermography is most known for breast thermography, and I think it's because of how much Breast Cancer Awareness Month is marketed to our country.
Sure.
And that's how a lot of people find me, because they do want to get a safe, healthy screening that's possible early cancer detection. But we look at the entire body, and from the top of the head down to the bottom of the feet, you can see a lot with thermography. Oral inflammation, carotid artery evaluation, you can check the thyroid. Even the bottom of the feet tell us all a story. How's that patient bearing their weight from the right to the left side?
Can't wait to dig into this. So tell us where we're going to begin here.
Okay, well, the first section, this is a woman's report, is the breast section. And what I see for this patient is she has some vascularity that we want to keep an eye on. She also has a focal hyperthermia, or one spot on the breast that's hotter than the other that we also want to keep an eye on. Globally, her left breast is hotter than the right, and that's above our threshold. So that has led our interpreting doctors to recommend for her lifestyle changes and also a follow-up thermography in 6 months' time.
So when you're saying vascularity, that's saying that we've got a blood flow problem somewhere.
Correct. That's exactly what that is. And vascularity in the body can be one of several things. It can be toxicity, hormonal imbalance, something from a tight bra, an injury. It can be breast cancer. So ultimately, if people are showing any abnormal heat signatures in the body, they need to work with their doctor to figure out how to balance things out and stop going in a direction towards disease and head towards optimal wellness.
What we're looking at now, I'm just going to tell our audience out there, we now have 4 images of therm, a woman's chest that we're looking at. And I mean, I can see it almost looks like a line on this left breast. Is that what we're talking about, where there's issues?
It is. In 6 months' time, that heat signature right there is going to do one of 3 things. It'll increase, stay the same, or decrease. And if it increases, then that patient, it could be cancer.
Okay, because now we have active vascularization or blood flow coming in because cancer has a voracious appetite, needs a lot of blood.
Yes, it's metabolic, it's hot. And cancer doubles on average every 90 days. So since currently this finding is within normal limits, that means that we want to see what it's doing after some time period.
Sure.
You know.
So 3, 4, 5 months, 6 months later, we want to recheck.
Correct. And then in the meantime, I don't want her to continue doing what she's doing.
Doing
I
nothing,
want
yes.
to have her do some of the tips. You know, some patients, they'll do one thing, like maybe start to exercise more. And some patients want to really dive in and they're going to exercise, change their diet, start seeing a chiropractor, get into an infrared sauna, and really make lifestyle changes.
So here we see red in the armpits and around the neck. Those are hotter areas, but that would make sense that those are hotter areas.
It does, yeah. I don't know that it should be so hot. We're going to go look at the neck in a minute here, but the neck could indicate that there's lymphatic congestion leaking from up above and kind of collecting right there. And yes, the armpits are usually hotter because there's an indent in the body there. However, they may not need to be that hot. She might wear aluminum deodorant or something that traps toxins right in the armpit. And she may need to sweat out some of those toxins that are right by the breast area.
And so we see that the breast tissue is blue, and I think you kind of explained a little bit before that that's because they stick away from the body, and so they're cooler. But should they be this cool?
Probably not. She probably does need to work on her blood circulation throughout her body. She can do that by working out, getting into an infrared sauna. You know about the medical device Beamer that improves your circulation. So I would ask that patient, start with exercise. How much does she exercise a week? What is she doing? Perhaps she needs to build breast muscle.
Okay.
There's a number of things.
So I'm used to looking at the color charts that you see here on the left, but why the gray ones on the right? What do those tell us?
The inverse grayscale, you can best see vascularity throughout the entire body. So even though you can see it in the rainbow palette, you can see it better in the inverse grayscale. So our interpreting doctors have drawn these circles on this woman's breast to calculate the temperatures within each circle. Okay. And then they draw arrows. It's kind of like if you've ever heard of a titanium marker that's injected into the breast after there's a finding on a mammogram. This is our marker. Just red arrows drawn on the breast. Yes. Completely non-invasive.
Yes. So we're seeing this kind of almost like a circle. Are you saying that's kind of blood flow? Where you see it kind of come in, it almost looks like a clamp.
Yeah, exactly. And with thermography, we cannot diagnose. So it's going to mean that this patient may want to do further testing, like get an anatomical study of the breast or do some blood work with her doctor. Even it could be the dentist. It could be, we're all connected. Yeah. This inflammation could be leaking down from the mouth.
So what's next?
Next is the head and the neck section.
Okay.
We jump back up to the written report. And the thermal impressions are what I always read to the patient, and I encourage them to read the comments and go over those with their doctor at a later time. Mm-hmm. But it says this patient has oral inflammation. She has an abnormal cerebrovascular screening, which is where we check the blood flow on the forehead that comes right from the carotid arteries. Mm-hmm. She is also showing neck congestion, lymphatic congestion, and it says it's possibly from a thyroid condition. When we go down to the head and neck images, you can see, I can better explain. So these two circles that are drawn on this patient's forehead, within each circle, our software calculates the minimum, the maximum, and the average temperature. And then we're symmetric, so you shouldn't have one side of the forehead that's significantly colder than the other.
You can certainly see it.
You can see it visually, where there's more green in the right circle there and more red in the left. And the difference from the right to the left side is 0.37 degrees Celsius. And the normal to abnormal threshold is 0.3. So she's just above that threshold. And at this time, they didn't recommend a carotid artery evaluation. Yeah. But for patients who are a little bit higher, and it depends on the age as well, then they could send them in to get a Doppler ultrasound of the carotid arteries. We want to rule out that there isn't an issue of blockage.
Sure.
Because thermography can't diagnose. It could be from one of several things. It could be the carotid arteries. It could be something from trauma in her lifetime, acne, eczema, psoriasis. There's a lot of things that can cause heat imbalances in the body.
Got it. So the next picture, what's on the next?
Next, this is the thyroid image, and you can see that looks really hot right over her thyroid. And to me, this patient has a mild oral inflammatory rating. We just saw a little bit of yellow right around the mouth. A lot of patients, we see the yellow wrapped around the chin and even leaking into the neck. The recommendation there would be for her to get thyroid blood work, rule out that everything's okay with the thyroid, hopefully, and if not, work with a physician who can balance that out. And from there, if the thyroid blood work comes back normal, she's got a lot of heat in her neck, so she would want to get rid of that lymphatic congestion. That can come from the sinuses, the mouth, and I would encourage her to see a lymphatic massage therapist, do some dry brushing, or do some exercises that would benefit her lymphatic system.
So for those of you out there, the lymphatics are blood vessels that travel along with our regular blood vessels, and they're usually one-way streets. They go out. And so if you cut yourself and it stops bleeding and it still weeps clear fluid, that's lymph. That's usually our white blood cells. And so the pictures we're looking at are some areas of blue, which would be cold, some areas of green, which would be normal. We're seeing then the yellow, and then more of an orangish, and then a red, which is the hottest. And so we're seeing that on the entire, each picture that we look at.
So each picture that we look at, our interpreting doctors do what we call the art of scaling. They move a little lever so that in each picture they make the hot colors pop, then there's warm colors that are in the middle, and then there's cool colors that also pop, because that's why we take so many pictures of the entire body, so you can see the different areas and what might need to be addressed.
Got it.
The next section is the abdomen, and her abdomen is looking thermographically normal. They didn't have any recommendations there. And then the next section after that is your specialty, the spine and the posture. Let's see what they said about that. They said the thermal impressions are interscapular, thoracic, and lumbosacral hyperthermia, and she's also showing postural deviation. The recommendations in the report here are clinical correlation and chiropractic evaluation. So we want this patient to work with their doctor if they have any abnormal heat signatures and how to balance things out.
Oh, fascinating. Look at that.
This is the picture I always go to for the back. We take closer up shots, but I like to see the whole back. And I ask the patient, are you in any pain because of this red along the spine here? And they say yes or no. If they say yes, I say, okay, well, that's a sign from your body that something is not right. Something needs to be addressed.
Yeah.
Please work with somebody who does body work or a chiropractor and help to balance things out.
Even in the low back, that blue that's going up almost to the kidneys is suspicious. I can see what they're saying.
Shouldn't have such contrast.
And look at how red the neck is.
Probably she needs an adjustment.
I would say so.
Then if somebody tells me that they're not in pain, that's wonderful, and we want to keep them that way.
Sure.
So same answer, get some body work done and come back to me in 6 months' time. We'll see what's going on with that back.
Sure.
And if somebody puts in the effort, you see improvements.
Yeah. Awesome.
And that's my goal for every patient, is to have improved thermography scans, because that's our testimony. They're heading towards optimal wellness. The next section is the lower extremities. That's where we look at the legs. This woman's showing questionable vascular hyperthermia and anterior tibialis inflammation. That prompts me to ask them questions like, how well are they stretching? What shoes are they wearing? Are they wearing shoes that have good arch support? What do they do for exercise? She looks like she's a runner. She's got a lot of inflammation in the shins.
Yes.
And it is equal on both sides.
Yeah.
So that doesn't indicate to me a posture issue. And then the glutes shouldn't be so cold compared to the legs.
Yes.
So I wonder if she's just naturally thin, or
and we've got
what she's doing there.
We've got a thyroid issue, which will certainly make the extremities cold.
That's why they need to see a doctor.
Lower leg, yeah.
Lower leg, yeah. These toes are so cold, they're black. The floor is magenta. Her toes are colder than the floor, below her. That is a circulation issue.
Yeah.
She needs to work on her circulatory system. And then the bottom of the feet, the arches look inflamed. So my guess is she does not wear shoes that have arch support. Or something is going there, and she needs an analysis from a physician.
Sure.
The last section of the full body scan is the upper extremities section. And same thing, look at her fingertips, they're black.
They're black.
This little rainbow scale over here shows you white or infrared is the hottest color in this image.
Okay.
And then it goes red, orange, yellow, green, blue, royal blue, magenta, and black is the coldest. Again, black fingertips are actually colder than the wall behind her. They shouldn't be so darn cold.
And look at the armpits, almost white.
Mm-hmm.